I'm the medical director of Homecare here at Black River Memorial Hospital. Homecare, I feel, is a very essential and important aspect of care to be provided for patients that qualify for need for additional medical services that can be administered in their home.
Homecare has been very informative. They've helped me learn different ways to move, how to get in and out of bed, while in bed, how to make things simpler. Because you're in your element where you live, it's amazing the stuff that they know that will make your life so much easier.
Black River Memorial Homecare received its state licensure in October of 2006. In January of 2010, we received our Joint Commission accreditation. We serve a 35-mile radius of Black River Falls, including all of Jackson County and parts of Clark, Buffalo, Monroe, and Trempealeau counties, as well as Wood. We strive to provide excellent care to the patients on the home care program, working to help people improve their outcomes and meet their goals of care. We work with patients of all ages and their families to assist them with establishing an individualized plan of care in collaboration with their physicians.
We wanted to talk about our home care program today so that we could have some facts out there for people and information so that if they want to know something about our home care program, they can get it here or they can give us a call. So I want to talk about our different levels and why we go into people's homes. If you've had surgery or an illness or something that you need to recover from and you can't get out of your home to get in for your doctor's appointments or for physical therapy or occupational therapy or speech therapy, we have all of these items available through our home care. So we can have these services come right out to your home. We have skilled nursing services where the nurses can go in and do assessments to see how things are going medically for you to make sure that you are recuperating or recovering and that there is improvement for you. We also have our physical therapist, occupational therapist, and speech therapist. If you're having any issues with some of your daily living and your transfers, those kinds of things, or for people who have had a stroke, they need speech therapy maybe to help with swallowing or learning to say certain words again, that kind of stuff. We have those therapies that can come out into the home and help you recuperate from that too. We also have home health aides, and they help to provide skilled nursing care. If the doctor has ordered home care and they have ordered a specific regimen for care, the home health aides and the nurses can make sure that that care is carried out, that things are done properly so that you will improve and recuperate. We also have our personal care services, and that's for people who need help with showering, bathing, just hands-on care. If you're having trouble getting in and out of the shower, having trouble getting yourself dressed in the morning or undressed in the evening, that's where personal care services can come in. So we have aides that will go out and do those kinds of things for you. We also have supportive care. That is a non-hands-on program. What that means is that if you need help with shopping, or if you need errands or transportation, or if you need help with laundry or light housekeeping, meal preparation, or making whole meals, then our supportive care services can go in and our aides can help do those.
What has it meant for your relationship with your wife?
I think it's given her a chance to get out and do something that she likes. Otherwise, she was 24 on. There was really nothing for her. And then she started, it's hard enough for her to take care of me, at times, but yet you're providing a service that is invaluable to let somebody come in and then let her go, and she can make a day of it.
The usual home care reimbursement sources might be private insurance, Medicare. Some people private pay for their services because they choose to have these services in their own home. Workers' compensation, if a person has gotten hurt at work, then the workers' compensation may pay for them to have some home care services. The Veterans Administration, the VA, they do contract with us to go out and do some of these home care services for people within our service area too. Our home care services are on call 24 hours a day. So if a person is on a skilled need level of care, then they do have a nurse that's available on call. If they're having some kind of an issue, they can give the nurse a holler and say, hey, I have these symptoms going on. What do you think I should do about it? Or do you think that I should go into the emergency room?
My part of home care is to go into the home, meet patients. I participate in admitting patients when they are seeing other disciplines like therapy, occupational therapy, speech therapy, physical therapy. I help with patients who have maybe new diagnoses, who need some education on their medications. Sometimes they may go into the doctor, into the clinic, and say, yes, I'm taking all of my medications appropriately. But when I get into the home, I discover that they have maybe misunderstood an instruction and they're not actually taking their medications like they should. So we catch those little errors before they become big health risks. Primarily, my goal is to help people become independent again, or to help them find ways that they can get help in the community and stay in their home. I think that's the biggest satisfaction of my job, is helping people stay where they want to stay and not have to go in someplace where they need more help. Sometimes we help communication between patients and doctors, because sometimes in the clinic or in the hospital setting we have an idealized view of what might be going on, and when we get out in the home we have a better idea of, maybe there's physical obstacles to why a patient can't, elevate their legs like they're supposed to, or their home is just set up so that they can't use a certain piece of equipment that they're supposed to be using. We get the kind of real world view of what the challenges the patient has. I think my job is just wonderfully satisfying. We get to know people, we get to become part of their lives for a little while, and help them out when they need it, and head on out again once they're independent and doing well. A lot of teaching is a big part of what we do, helping people understand new diagnoses. Maybe they're new to diabetes, or they're new to a colostomy, and we teach them how to manage it themselves. Sometimes it's a wound that we go in and do dressing changes and keep an eye for infection until they are able to heal.
We have a lot of fun. We do that. Not only for them, but for me too. Oh yeah, I've said a lot of things that I wouldn't say to anybody. Well, they go shopping. If I don't feel like going along, I don't go. We have a list that they make of what we need, and they just go ahead and do it. So it works out real good. And if I feel like going, I can go along. They put it all in the back seat, and off we go. Dorothy just helped me into the shower so I could take a shower, because sometimes you get a little woozy. So I had that this morning. She took care of all those little things that you have to do, So that was very good. And going to the doctor, that's great, because these gals know more about what's wrong with me than I know myself, So they can put in a word here and there to the doctor that I wouldn't think of.
We also offer telehealth services to all of our patients. This is a service where we bring into their home a scale and a monitor and a blood pressure cuff that we can do daily vitals, multiple a day vitals. We can do 4 or 5 times a day. They can be set at individual times of the day so that they can be taken every 4 hours or whatever is needed. There's also a series of questions that can be asked, things like, are you having more difficulty breathing today? Are your ankles more swollen? We can even set reminders in there for them to remember to take their medications, or remind them of doctor's appointments, or to remember that a nurse is coming out. All that information is then transmitted back to our computers so that we can see in any given day, where people's weights are running, or blood pressures, or respiratory rates, or oxygen saturations. So it can help prevent extra nursing visits. It can actually clue us in that we need an extra nursing visit. It can help prevent hospitalization if we can catch things early. It's a really, really great service.
The nice thing about having home care is that we can come right into your home and see what the setting is around your home. We can make your home a safer place for you to be and a safer place to recuperate. We really do help the whole family. We help with teaching, and so the patient can learn, the family can learn. If there is a certain exercise regime or something that a patient needs to do, we go in and we teach that to the patient. If it is a patient that has a new injury or a new wound, we can go in there and we can teach them how to care for themselves or teach a family member how to do the cares for that patient. If it is a new diabetic, we can go in and do diabetic teaching for the patient also and for the family. So it really is a patient-centered but family-oriented kind of care.
So as an occupational therapist, I address safety in the home and conduct fall risk assessments. 1 in 3 individuals age 65 and older fall each year, often resulting in injury and decreased independence. The individual's home is assessed for possible fall hazards. Distance vision is assessed. Medications are reviewed, and if not already being addressed, strength and balance exercises are added to the individual's daily routine. Fall prevention education is provided and recommendations are made to help the individual decrease the risk for a fall. The overall goal is to keep people on their feet and in their homes.
Black River Memorial Home Care, because there's no place like home.